My name is Morgan. I'm going to be your nurse today. Can I get your name and date of birth, please? Great. Do you have any allergies? No? Okay, we're going to go check your orders and we're going to see what we're going to do for you today. Alright. So it looks like we're going to be giving you a unit of packed red blood cells. Should take about 15 minutes. Do you have any questions about it? No? Alright, I'm going to get my supplies and we'll go ahead and get started. Okay. So before we can get started, I'm going to need you to sign this consent that says that it's fine that we're going to be giving you blood and the benefits about it. And then I have a little bit of patient reading. You can read about the transfusion, why it's being done, and all that kind of stuff. You go ahead and sign that. Thank you for signing that. Okay, I'm going to check my blood card here with your wristband to make sure that I have the correct patient. I'm going to be getting the correct kind of blood. So your name, date of birth, and your ID number match. Great. So now, I'm going to do this education with you. I'm going to take your pre-vital signs here. Just make sure everything's okay.
Also, make sure you're checking the pre-lab values.
Yes. I'm going to go check your pre-lab values in the computer. Everything looks great.
Still need to discuss with you. Blood products should be administered within 30 minutes of arrival to the nursing unit.
Exactly. So that is why before I go over there, I'm going to set up my primary solution. And the IV, I'm looking at it, looks good. I'm going to check for patency. I need a alcohol wipe. Got some blood return, still patent, so great. We're gonna go ahead and flush that. That's fine. And I got my normal saline here. Alright, that's primed up. Just gonna wipe it again.
sure to clamp your blood tubing or your blood tube.
Yeah. And this is a basic infusion. Rate, we're gonna do 15 milliliters an hour. All right. Now I'm gonna run out of blood bank since that's already going, and I'm gonna go pick up your blood with this in my face sheet. All right, I'm at the blood bank. Drop this off. Okay, yep. Looks like the right kind of blood. But and when I go back to my patient, I'm gonna have another nurse check this with me, that it's the correct order, the correct type of blood for the correct patient, and everything just matches up.
I am the second nurse.
Everything match up?
Everything matches.
Okay. It is appropriate to administer this blood. Okay.
And you got the consent, the expiration date, the type,
Yes.
the number, the patient name, and yeah.
Okay. And so,
And the order for the blood.
at this moment, we're gonna pause this. And we're going to sterilely do this. Ooh, it's golf tee.
Clamp your saline.
It's clamped. Oh. My saline is clamped. That was. So now. Saline's clamped, my blood. I'm gonna unclamp that. And at this moment, go let this blood come down.
Do you have a trash can over there? Oh, never mind.
No, I'm just letting it
I forgot.
infuse into my patient. And before this, I checked my vital signs, and they were okay, doing well.
Tells me to tell you that the infusion rate should be stirred between 15 and 25 milliliters per hour
For the saline?
for the blood
On our sheet says 60.
at first. Oh, well.
Okay. And we're almost down to our patient at this point.
Don't shoot the messenger.
once our blood is just about to the patient, you're gonna clamp it down. And then insert this. We're going to go to this. Secondary. Oh, wait. Now, find blood. You got options. This is a guardrail fluid, packed red blood cells. That's correct. And then I'm gonna have another RN check this with me again to make sure this is okay, that I'm giving the blood that's the correct patient.
I am verifying. I am the second RN.
The rate should be at 60, but that thing says 20, so volume to be infused. There's 300 mils. We want all of it, but so we're gonna go ahead and start it, and now I can unclamp this. So I'm going to be staying with my patient as this is infusing, make sure there's no allergic reaction, and I want them to let me know if they're itching or have any sensations that don't feel right with this. All right, it's been 15 minutes, so now I'm going to check their vital signs again. Okay, vital signs are positive, so at this point, I can pause this and then change my rate up to 125 to 150 by a 300 ml bag. So I could do 150 because it has to be into here in 2 hours, 2 to 4 hours. So we're just gonna start at 125. And then I'm gonna stay with them for a minute, and then I can go away and let them call me if they need me. So then
Recess vitals
I
every
come back.
15 minutes.
that's after 15.
Yeah,
This is
recess every 15.
Every 15? Okay. Every 15 I'm assessing. And so at this point, the infusion is done. They have all the blood. So I'm gonna go ahead and check their vital signs one more time. Okay, their vital signs are positive, everything is looking good. At this point, I'm gonna switch over to the normal saline and let that run. I'm gonna go ahead and document the time, how they tolerated it, the type of blood that they were given, when the infusion was completed. I'm gonna keep the empty bag of the blood on the unit for 1 hour in case they have a negative reaction, and I'll have that on site. I'm gonna have them let me know if they need anything else or if they have any other reactions. And then I'm gonna let the saline just continue to run. And that's it.
And hygiene.
And hygiene.
And what you're going to document. Oh, you already said that.